Greetings. This is Kenny Anderson speaking today on Black Lives Matter of Factly. My topic today is discussing black mental health problems. Recently, a good friend of mine shared his concerns about what he sees as a black mental health crisis currently. There's so many black folks he sees, whether family, relatives, friends, and other black folks, are mentally distressed and stressful to deal with. My friend, who's a community leader and life coach, says it seems like black folks have too many defenses and are in denial to deal with their mental health problems. That those black folks who do receive mental health services don't really improve much. They're just doped up on psychotropic drugs, medication. The overall services are ineffective. Yes, too many barriers. I told him that indeed there are mental health barriers. I highlighted 8 mental health barriers to him, beginning with number 1. The current mental health crisis he highlighted is the unaddressed, compounded effects of the psychopathology of white supremacy. Number 2, black stigma. There is black shame and a sense of weakness to admit that black folks have mental health problems. Number 3, black mental health illiteracy, not knowing about mental health disorders and symptoms. Number 4, blacks self-medicating themselves with alcohol and drugs to cope with their mental health problems. Number 5, the overwhelming majority of agencies that provide mental health services to black folks don't provide culturally specific, relevant treatment. Number 6, the major socioeconomic determinants of black mental health problems like racism and poverty are not addressed. 7, the percentage of black mental health professionals that blacks can relate to is very low in the field of mental health. There are a low percentage of social worker, therapists, and psychiatrists. Number 8, there are very few black mental health, self-help, and advocacy groups. Furthermore, I went on to discuss with this good brother that during the COVID-19 pandemic and its persistence, black mental health disparities have been amplified. There's been an increase in black anxiety, depression, adjustment disorder, suicides, and homicides. Since this is February, Black History Month, from my perspective, we have to place the current rise of black mental health problems in a historical context of racial oppression producing generational trauma. Indeed, for black folks, our whole existence, from past to present, has been an ongoing mental health problem for us. Indeed, the enslavement, black Holocaust trauma of being war captives, held in slave force, placed in the hulls of slave ships, the dreaded Middle Passage, sold on auction blocks, family separation, beatings, whippings, rapings, and lynchings, coupled with breeding farms that in instances produce incest, were the oppressive ingredients to warp our genetics, our DNA, leaving us permanently stained with mental health problems that formulated over 246 years of slavery. In the past post-civil rights period from 1865 to the present 158 years, our mental health problems continue due to the trauma of Jim Crow segregation, repression, and Klan terror. Continue with the racist war on drugs, crack cocaine imposition that led to massive black male incarceration, massive drug addiction, massive neighborhood destabilization, and massive family disruption and massive placement of black children in the foster care system. Yes, the 40-year racist war on drugs, pandemic, trauma just continued right into the COVID-19 pandemic that has resulted in massive black infections, disability, and deaths. And I also need to mention in the past 10 years, black people have been traumatized, specifically black men, by racist police murders. The black mental health problems in the post-civil rights period has been called by Joy DeGruy as post-traumatic slave syndrome. Ms. DeGruy says, which is a fact, that blacks have never addressed our long-standing and emotional distress enduring injuries of racist-induced mental health problems. In order to address the ever-growing mental health problems in our communities, as black folks, we must engage in a massive self-determination, internal reparations effort in the same way that we must demand economic external reparations from the American government and American corporations. The struggle continues.